Welcome back. Yes, I did a bunch of videos all in the same section, but you're alright. So here we are back again. We are not back for week 5. We are actually at the end of the month. So we're going to kind of go over at the end of each month of pregnancy, doctor's office visits and tests, things you might need to look out for, what should you be doing, and maybe some risks. And those are kind of going to be my next 3 episodes. So this month, not a whole lot going on with the doctors. If you do IVF or you are someone that's had fertility issues, including but not limited to miscarriage, are stillborn, and just not being able to get pregnant, you really want to be doing blood work. You want to be paying attention to that HCG and making sure that those levels and progesterone and estrogen are all where they should be every single week. And especially during IVF, during having them transferred, this month you're going to be doing a lot of ultrasounds, you're going to be doing a lot of blood work because you need to make sure that the embryo is transferred, implantation is happening, your hormones are where they need to be, and let alone if you're doing fertility, they may even ask you if you want to do an ultrasound. You're not really going to see anything more than an egg sac, but they probably want to be paying attention to make sure that it's there, especially around week 3 and 4. They're definitely going to be doing blood work. They definitely want to be paying attention to that after your first missed period. So, again, closer to week 3 and 4, because that's where your hormones are going to be really at the perfect place to confirm your pregnancy. So the blood work is worth it to make sure you're pregnant, let alone they want to stay on top of your HCG to make sure that is where it needs to be, because that's going to be the biggest indicator whether this pregnancy is going to be viable or not. And same thing with IVF. And other than those scenarios, you're really not going to see a doctor. If you just are regularly pregnant, they're probably going to ask you not to come any earlier than week 7. Some doctors are week 7, some doctors are week 8. You will find out more we go into videos down once we get to week 7. Why after week 6, there's no point in really getting to the doctor, but we'll get down there then. But month 1, unless you're having fertility issues or treatments, you're really not going to be seeing a doctor, and you're just going to be taking a pregnancy test to confirm you're pregnant. And you can do that at your doctor's office or your regular family practitioner, to be quite honest with you, because an OB probably still is going to ask you to not come until after week 6. Even with that, they're going to say take an at-home pregnancy test and I'll see you at week 6. We can schedule it out. But a family practitioner, you can go there and get one. But honestly, over the counter is great. I would say the earlier, because this is an earlier pregnancy, you want to stick to good pregnancy tests. Some of them are just not that great at catching the HCG in the very beginning. Especially because week 4 is when you're in the highest point outside of the couple weeks after of HCG, and that's what your pregnancy test is confirming, is by the HCG. So like Dollar Tree ones work great, but they really work better after month 1. They're really better for more like month 2, and any brand within month 2 will work great. But I will say Clear Blue, and there's like a purple box, I cannot remember. Those are 2 great over-the-counter pregnancy tests. They're a little bit more expensive, but honestly it's worth it. I was broke as a joke both times as I got pregnant, and I still spent the money on those. And really, you only need one. If they say you're pregnant, you're probably pregnant. Obviously, false positives happen, but if you stick with the better brands the first month, the likelihood is not going to happen unless you have fertility issues. And like I said, HCG, when you test, is surged and it starts to decline, which is things that they pay attention to through blood tests. But test-wise, doctor's offices-wise, and things to look out for is too much bleeding, pain, headaches, anything that might slightly feel like a contraction, which is consistent pain over and over again, cramping over and over again, intense cramping, not just period cramping, because you can get that with the transition of what's going on with hormones and implantation and all of these things and the swelling. But those are things to look out for. And bleeding, light bleeding is normal. Anything more than light bleeding, a very light period, is worrisome and someone should know. Family physician, doctor, or OB doctor, it doesn't matter which, but someone should know, and you need to get your HCG tested. that's it for month 1 test things and to look out for. So if you have any questions, let me know below.